Good afternoon, ladies and gentlemen, and thank you for joining us for today's Nuance webinar, Patient Engagement Improves with Patient Portal Support. Just a few housekeeping items I want to go over before we get started. All attendees have been automatically placed on mute. Today's presentation is being recorded, and a link to that recording will be provided to you typically within 48 hours at the end of the presentation. If you have a question, you can submit it at any time using the Q&A panel that you should see on the right-hand side of the WebEx interface. Again, you can submit your question at any time. We will hold those until the end of the presentation to actually address them. But again, feel free to submit them at any point. I want to welcome today's presenter, Mandy Love, who is the Director of MyChart and Clinical Service Desk. Mandy brings over 15 years of experience in IT operations, application development, and support. And it was after leading a MyChart deployment at Duke University Health System that she decided to bring her expertise to Nuance, where she was instrumental in developing the MyChart Service Desk offering. She has an extreme focus in patient portal programs, development, and support, and she and her team have supported MyChart developments across large IDNs, pediatric organizations, and community hospitals. And as a patient engagement expert, Mandy has a passion for helping healthcare organizations provide tools that help bridge the gap between providers and patients for improved outcomes. Okay, just a glimpse into what you can expect to walk away with from today's presentation. So we're going to touch on patient portal expectations, anything from the portal introduction to meeting patient expectations and how that impacts your organization. We'll talk a little bit about developing a patient portal program, what success factors you can see, and what are the organizational benefits that might be derived from such a program. And then lastly, we're going to talk about the Nuance Epic MyChart service, specifically focusing around optimization, assessment, and delivery, support and ongoing evolution, and then a glimpse into some customer successes that we've had. So with that, I am going to formally turn things over to Mandy to go ahead and get started. So Mandy, you should have control of the presentation now.
All right. Thank you, Amy. Good afternoon, everyone. Thank you for joining us today. As Amy just touched on a little bit of our learning objectives today, what we want to do is kind of take a look back over the history of Patient Portal, right? The journey that became, how it came to be, and how it created expectations for our patients, and how it impacts health organizations. Along the way, we'll look at, how do we prepare for that? How does your organization prepare? And how does the organization receive benefits from doing this successfully? And then we're going to take a deep dive into the services and solutions that Nuance and our teams have developed here to help you along the way. So we know that patient portals were in existence. They have been for a long time, but it was really the rise of meaningful use that really brought that into the mainstream, right? A lot of organizations already had patient portals, but that's really what drove us to this point. And then the goal for that was really just to allow the electronic access of patient records was the main goal for that. So that was allowing your patients to receive clinical summaries, their secure electronic messaging, right? Timely access to their appointment reminders, refill requests, things like that. So that is where meaningful use brought us. But what it did was it actually created expectations with our patients, right? So not just in healthcare, we were also adapting this portal concept, but in other facets of our life, as consumers, we were using portals in ways that really drove this expectation for our patients, right? So now they want real-time access to their information, the ease of access, being able to access it anywhere, online or on mobile apps, the ability to pay your bills, those refill prescriptions, creating that open line of communication in between our providers, managing appointments, all of those things is really what emerged from this, right? Created that expectation for the patient. So how does your health organization meet that, right? What are the challenges that health organizations are facing along this journey? How are you going to meet that demand, right? How are you going to have a robust program? Along the way, though, we see this time and again that organizations struggle with meeting this demand. So some of those challenges that you've probably faced along the way are that a patient portal, MyChart, is not just a single operation, right? It truly is a combined patient experience. So you're bringing all of these different elements. You've got your clinical aspect, you have patient access for scheduling, you have a compliance legal obligation through, release of records, allowing proxy access to your patients and their caregivers, paying bills online. So this truly was an experience of an organization where it wasn't just one department leading the way, right? And so that's something that creates a challenge. The inability to provide the support 24/7 to your patients. They use the patient anytime they need it. They use the portal anytime that they need it. So being able to provide that 24/7, and in a lot of cases that bilingual support can affect the adoption that your patients have for your portal. And then what happens when they aren't actually adopting those features and functions, right? You're going to have not the optimal use of the portal itself. And then you find it challenging that your resources in-house, your IT resources are pulled in so many directions that they aren't able to truly focus on deploying the features and functions that need to be built in order to, again, achieve that optimization and the use that you're looking for in the portal. And then with that, your adoption and your outbound campaigns suffer. You're not able to achieve the activation rates that you're trying to achieve with your patient portal. So a lot of these challenges are what we see organizations experience along the way when you're trying to meet the demand for your patient population. So what happens then, right? So we know there's a demand. Organizations might struggle to meet that demand. And unfortunately, it can cause negative outcomes for your organization. So from a patient perspective, you're likely to see that the patient engagement goes down. That's going to, in effect, affect the outcome, the health outcomes for your patients, along with the follow-up care that they may need. The adoption we talked about for the patient portal is not going to be well, because if they've had a bad experience, they may not come back and use those features or functions again. And then in a world of social media, we know that there can be negative reviews from your patients. So that's going to be placed online. And unfortunately, they may end up seeking to find another provider. For your physicians and care staff, right, that those possible negative reviews are going to impact the reputation possibly. It's going to affect the growth of maybe a practice or a purpose that's occurring. And if we're not using the patient portal and workflows in the appropriate way, it's going to possibly create excessive time to continue those manual processes that are in place today, where you could be more efficient by using the patient portal to communicate with patients or to do a lot of that online. And then we also see that because of some of those restraints with resources and helping with the patient portal, it may create the opportunity for organizations to be multiple applications that could do some of the features and functions the MyChart portal has available, right? So we're, again, bringing on more inefficiencies instead of streamlining things. And then for your overall organization perspective, it's going to impact your patient satisfaction scores, your overall patient retention, right? That's going to impact your growth. Resource costs might increase. Again, if we're not using those workflows efficiently, you're going to be looking at folks that have to continue to carry out those processes, going to increase those costs. And then back to possibly the use of multiple applications. If you're not getting the best out of your EHR, then you're going to be paying a different application cost to support some of those functions that may already be available today in your patient portal. So we know that there has a demand out there for the patient portal. And we talked a little bit about the challenges and the impact that not being successful or having a great program in place. So what do we need to consider to make sure that the organization's portal program is successful and in line to achieve these goals and meet the demand? So we've outlined a couple of different things that we consider success factors. The first thing is an oversight committee. So as we talked earlier, your patient portal is multifaceted, right? It no longer touches just one part of your organization or one department. It reaches across all entities. So the purpose of an oversight committee is, one, to achieve and streamline that, right? To have everyone's buy-in at the organization. You don't want one department feeling like their needs or workflows weren't considered. So that way you're bringing your whole organization together. And then as a group, you can set the roadmap. You're going to look for that long-term guidance. What are your goals? What are you trying to achieve in a month, in a year, really setting that roadmap for success. The other thing that it's going to do is, again, that cross-departmental collaboration, right? If you don't have that oversight committee, you're not going to see, you may not see the impact that one function or feature may have to another department or entity. So really creating that collaboration. And then you're also going to understand the requirements and processes of each entity, where if a single entity is designing and deploying your patient portal, again, you don't have that consideration of what marketing might say. Marketing may have a patient experience perspective versus the clinical perspective or the billing perspective. So really understanding those departmental processes and requirements, allowing you to bring that together to deliver. And then again, your innovation, like again, back to that roadmap. What are you planning to do? What are you innovating, and what are your adoption objectives to your patients? So this is basically what your oversight committee is going to help you accomplish. And then the patient portal features. You know, we talked about the things that are exposed to the patient when portals became to be, and creating that demand. So making sure that you have these high-value patient portal features deployed, that the bill payment, test results, scheduling online, the secure communication with your providers and caregiver teams, the release of information, having mobile apps available, and then, of course, questionnaires and e-check-in are going to be some of those key features that you have deployed to meet that demand your patients are expecting. And then we take buy-in a little further. So we want to see operational buy-in. So we've talked about the committee and what they're going to help achieve and how they're going to allow each entity transparency into their needs, goals, et cetera, as an organization. But to take it a step further, you want your internal resources, so your clinical staff, your support staff, your patient access, they all have to be aware of the functions and features, the goals of the organization, to really help deliver that message to the patient and use those functions and features. So they need to understand the value to an organization and departments. You know, what is this going to bring to them? You know, if you streamline these processes, it's possible that you're going to be taking a workload off of your internal clinical staff and resources, right? So you're going to look at those processes to include the patient portal features, medication renewals, for instance. That's something that they can take off of their plate and they can complete through the portal. So them understanding the value in these features and how you're going to deploy them is really going to create that buy-in from your internal resources. And then enable your support staff and your clinicians, right? So that means that you want to focus on specific training initiatives so that they're aware of how these features function. How does this play into their everyday process, from checking in patients to receiving the after visit summary when they leave? They need to understand how all of that functions. And then you want to continue to look for opportunities of improvement. Make sure that anytime new processes or new functions are involved in the organization, whether that's billing, whether that's new results, allowing patient-entered data through flow sheets or questionnaires, allowing them those opportunities for improvement. And then last, we want to look at real-time support. So we know that patients want the patient portal. We see the demand for that. But in order for them to adopt and continue to use these features, and also to achieve that success of taking some of these workflows and processes off of your internal staff, is to provide that real-time support. So patients are going to be looking for timely responses, assistance with activation problems whenever they occur, making sure that they adopt the self-service tools correctly. They're looking for omni-channel opportunities to communicate with your teams and your support staff. So there's no more just wanting to receive things by phone. We're now looking at other channels. So we have email, we have online chat. With Epic, you have in-basket messages. So there's multiple ways that they're looking for support. And you're looking for someone who understands the needs from your patient perspective. So you're looking for a support model that's going to support your patients, right? Very customer service, very patient-focused type of support. And then you're also wanting to make sure that whoever is supporting your patient has a full understanding of your organization goals and processes. A patient is not, as we all know, patients call. They're not looking for just a single answer. A lot of time, the support bleeds into every other area, right? A billing question in my chart could possibly turn into needing to speak to billing. So truly having a support model that supports all of those processes that branch from the patient portal. And with the success of those particular success factors that we talked about, one of the things that is also going to happen is not only are you going to achieve your patient expectation adoption, but the organization itself is going to benefit from these outcomes, right? So as we touched on how we can receive the buy-in, the benefits also come into play there. So you're going to see a reduction in communication costs, right? So now you may no longer need to send appointment reminders via the mail. You may no longer need to send billing statements. That's another thing they can receive through patient portal. And alleviating the burden from your staff and your administrative support. So by allowing them an electronic avenue to communicate, whether that's appointment request, scheduling an appointment, sending secure communications to their providers, all of those things are going to alleviate that burden of your staff. And we're going to improve patient satisfaction. We know this is what they want. This is what they've requested. So by providing these functions and features, giving them this real-time access, we're going to create patient satisfaction, retention, and loyalty is going to improve. Another thing that this also helps with is the efficiency between your caregivers and your patient. So now you have the availability of where a patient's not just calling in and asking a question, but if they complete this through the secure communication, it's automatically tied to their patient record and everything is documented. So it's creating that streamlined efficiency for your providers. You're not going in and out of systems between phone calls and messages. So that's another positive outcome. So when we look at this and we want to put an ROI to it, we have an example here. This is just one example, but for instance, the University of Iowa Health Care did a study, and these were some estimated costs that they found they saved. They were able to put this in an ROI format, and you can find that online. But just to give you an example of your cost savings, so we have an estimated savings of $3 for each appointment management interaction or each customer service interaction that your internal staff would field. Also, at a little higher price point, we're looking at $5 for time savings for your medical advice request, renewal, provider messages, and those paper questionnaires that continue to be used in offices in history forms. So how can we help? So we've identified the need for the patient portal. We've understand the demand and the obstacles that it can present to each and every health organization. So we have devised a line of services and solutions that can help with any one of these things during your Epic MyChart journey. At this point, I believe that most everyone has probably transitioned past an implementation or well into their MyChart program. So where we can start. So we can do an assessment where we're going to look at your existing MyChart program. We're going to review your governance structure. So that's back to that oversight committee. Who is engaged? Who are your MyChart owners? Who's making the decisions? What's your change management process? Do you have that cross-departmental buy-in, right? We're going to evaluate that and understand where that lives. Most of the time, there is not really one. Most of the time, MyChart is owned by a single entity, and it's deployed under the IT umbrella. So we find this is truly a big undertaking for organizations. And then we're going to look at your functions and features. So what do you currently have planned? What's deployed? How are your patients using it? Do you find there's already challenges for them? So we're going to look at those, realize what's the highest impact to your patients, look at best practice, and as we mentioned, a list of features that your patients are looking for, and how do we make sure that they're functioning in a way that your patient is going to adopt those. We're going to look at the web portal itself and your mobile application. How are they using the self-service tools? Are they easily available? Do they function quickly? And what are your password and security constraints? Do I get locked out after one time? Do I get locked out after 3 times? Understanding those requirements. Do I always need to know my medical record number? Do I need to know my social security number? Some of these things present real challenges to patients that we can help overcome. And then another really key place is the content and access to your frequently asked questions. So your patient is there to self-serve. They want to use your patient portal. So how can we make those FAQs more detailed and specific so that patients can find the answers that they're looking for and not need to go any further? Looking at your clinical and operational workflows, how are your patients being engaged? Where are you issuing activation codes? Is it prior to coming to the appointment in their appointment reminder? Are they doing instant activation? Is your patient access folks giving that upon arrival or checkout? Are you allowing them to activate their accounts in your exam rooms? Looking at your result release process, are you releasing results in a timely manner, or are patients still needing to wait on a turnaround time and therefore having to call the office still? Patient reported data, are you using your questionnaires efficiently? And secure messaging. Are your providers and clinical support staff truly leveraging the secure messaging feature and to communicate with patients? And then looking from a patient perspective, looking at those workflows and expectations that we've been talking about all along the way. How do your patients use it? How do they perceive the activation process? Is it easy? Is it challenging? Can they find the MyChart URL easily when they look for your organization? I mean, these are some things that can truly create problems with the patient workflow that we would be able to evaluate. How do they request proxy accounts? Is the patient education easily accessible? Are they able to click on links within MyChart? These are all of the things that we're going to be looking at during our assessment and really evaluating for your patient population, your clinical staff as well. And with this evaluation, the assessment, we're going to create action items from that. So we're going to be looking to give you guidance, right, to help you coordinate or strengthen that committee that may already be in place. Who do you engage? What roles and responsibilities will these players have? Deliver some quick wins, right? How can we, as I mentioned, most people are already down the journey in their patient portal. So what are some quick wins? Like, how can we efficiently get some problem things, some roadblocks out of the way for your patient? That's going to be looking at those self-service tools we talked about, the web pages, the easily ways we can update your web page so they can access information better, those types of things. We're going to look at streamlining those workflows. So back to how the patient receives activation codes. How is your clinician releasing results? Looking at those and providing guidance and action items for that, right? And then we have our certified build resources that can help achieve all these. We have our training credentialed team members that can help with that enablement. So once you make these changes, once you do these streamlines, how can we enable your internal teams to make sure, again, they have that buy-in and they're using these functions and features properly to improve their efficiency. We have a focus team, support team that can help with your marketing needs, campaigns, phone calls, written communication, and then support to your overall patient population, making sure they're getting that real-time support to improve your adoption and those patient satisfaction scores. And then ongoing, we're going to be looking at data analysis, patient feedback we receive on a regular basis. How is it used? What are those usage numbers looking like? And then we're going to formulate continued improvements along the way. And then as many of you are past possibly generating and creating a new MyChart program, you may already have achieved all of those things. So that's when we're just looking at the support model. So we do have an Epic MyChart support desk. That is going to be a dedicated team. Our resources have multiple years of Epic MyChart experience support. They are patient-centric, as we talked about earlier, making sure you truly have a support model and folks that understand the needs and the processes that your patients are using and making sure they are aware of the places and functions they need to go to. Having bilingual support, 24/7 support as well, and then achieving all of those avenues of communication that your patient is looking for: phone, online chat, in-basket messaging, email. We are able to achieve all of those things. And by rolling out our best practice, we see at least a 95 or higher % first call resolution for our clients and our patients. That is resolving those on your first instant with your patient and no longer needing to send those requests to internal resources to field and resolve and reach back out to your patient. And not only do we know that this is what patients demand, but our ongoing analytics also shows that. So we know that at a minimum, we see at least 15% of inquiries for MyChart support after business hours. If you actually consider the time before an office opens or closing at 5 p.m., it actually goes up more. So we're probably looking at 20% of your patient population is looking for support outside of those business hours. And our ongoing analysis is also going to help identify trends that we're seeing from your patient issues and calls. Something very common here, everyone who has supported or looked at MyChart data is going to know that a majority of the things are password, username, activation issues. But we see lots of other things. We see need for proxy help. We see need for navigation. We see need for technical issues. And having a well-rounded support option, being able to provide all of those other issues resolution 24/7, again, is going to achieve that demand for your patients. It's going to improve your adoption from patients as well as your internal staff that is receiving the efficiencies from using this. So not only are we going to continue on our improvement journey, but with our data analysis in action, we're going to be digging into each of those categories. So on a monthly basis, you would receive an analysis from us that's going to look at issue trends. What activation issues might they be having? Process accountability. Are your internal folks truly following the things that they need to be doing? So some examples would be that we consistently see patients are trying to activate their account and they have a generic Social Security number on file and can't do that from home. So they call in for support. Process accountability. Hey, I've messaged my provider, but no one is responding. That's the feedback that you're going to receive from us on our team that are going to be actionable items that you can improve upon internally. How do we continue to evolve the self-service tools based on these types of trends that we've identified and can send back internally? Any potential build issues, right? So you've just deployed a new feature or function, and we want to make sure that patients are easily adopting to it. That's something that we can consistently monitor and provide feedback. And then again, when you roll out that new functions and features, how can we help you with patient campaigns, right? Letting them know there are new functions available. And then back to that internal resource enablement, right? It's a continuous process. It doesn't just stop once you go live with MyChart. These are some of the value adds that come from the analysis that we do on a regular basis with your MyChart. And to share a recent example that we have from a client. So the client was looking to bring in they were a steady state Epic customer. So again, they have already rolled out their MyChart. Their MyChart program is in place, but they were looking for a partner. They needed to provide dedicated support 24/7 because they wanted to roll out some new features, and they knew that that was going to increase the need for patient support. So we partnered with them for our MyChart support service desk, and we estimated that they were seeing about 500 patient calls per month based off of the data that we had. So we rolled out the support model, and within the first month, we saw over 3,000 inquiries from the patients. This was not expected, obviously. So we wanted to look at what was causing this. What were the challenges that patients were facing that increased this call volume? So we did an assessment for MyChart. We evaluated the functions and features that they have. We evaluated the website to understand what was happening. So one thing that we noticed was that the support phone number, where it was placed directly on the home page. So what we found was that the patients weren't even attempting the self-service tools. So we wanted to remove that number altogether. So that was one of the action items that we took. And then the other is we wanted to encourage the self-service tools before they actually reached the support line. So we updated our outbound IVR message to inform them that the self-service tools for username and password resets were available 24/7, and they could act upon those on their own. So once we put these changes in place, we actually saw the volume decrease by 1/3 or more the previous month. So we achieved what we were trying to do and met the goals with our clients. And so shortly thereafter, they actually, like I said, our goal was to bring in the support. So then they proceeded to roll out new features. They implemented billing, patient questionnaires, and scheduling once we had our support model in place. So overall, we just want to show that no matter where you are in your EPIC journey for MyChart, we have taken all of that into consideration and want to make sure that your program is successful, your patients are getting what they've demanded, you're seeing efficiencies with your internal clinical staff, and really achieving that patient satisfaction. So we have our resource expertise. Our team is MyChart certified. We are patient engagement experts. We really focus on your operational process related to your internal clinical workflows as well as your patient needs, and really having that patient-centric mindset from a support offering. And then with our optimization services, right, we're going to identify improvement opportunities. We're going to help you build and deploy those if that's something that you need. Make sure that we are adapting the build for adoption, making sure we are helping with ongoing upgrades and improvement opportunities with our ongoing analytics, right? And then we have our real-time support. So really meeting your clients and your patients where they need to be, providing that real-time support on any channel that they're needing it. Okay, Amy, I think that is all for my topic today.
Excellent. Mandy, thank you so much for sharing your insights with us today. I just want to, before we get into the Q&A, I just want to talk a little bit about next steps. So now we've given you just a brief introduction to our EPIC MyChart Service Desk offering, and you potentially want to connect with us and learn more. A couple ways you can do that. We certainly ask that you subscribe to our What's Next Healthcare blog. We'll be certainly sharing additional insights over the coming months on a variety of topics. So you can see the URL here on the left-hand side. If you're ready to connect with us live, we suggest that you reach out to your existing Nuance account executive, or feel free to call into our 800 number listed on the site there, or certainly go ahead and visit our website for more information on additional EHR services that we offer. And then we are going to be visible at the EPIC user group meeting that is happening at the end of August. So if you come out and join the EPIC Madness out in Verona, we will be there. Please, and we encourage you to come by our booth and speak to some of our executives that will be on hand. All right. Okay, so just as a quick reminder, today's presentation was recorded, and a link to that recording will be provided to everyone typically within 48 hours of the end of the presentation. So now I'm going to move into a little bit of Q&A, Mandy. So a question that we have here, Mandy, is what really is the first step that a health system should consider for embarking on a MyChart program?
I would say that the most critical step is going to be creating that oversight committee. I think that's going to bring you the best value long term, right? I think that if you achieve that first, you're really going to create the opportunity to understand how this impacts and what insight each of those entities can give you. And it's going to create an opportunity for achieving your long-term goals a lot quicker by allowing that and letting them buy into the concept of patient portal and what you're achieving for your organization and your patients.
Great, excellent. Thank you so much. So I know you talked a lot about kind of analytics and what our team. Can you talk a little bit more about what specific analytics that a health system can expect to see from the Nuance team when they embark on an engagement?
Yes. So typically during an implementation process for our support services, we will provide analytics on a much more frequent basis. But once we get past that, we're going to be looking at a monthly analytics review with our team. And what that's going to include is you're going to receive a dashboard that's going to show you all of those trends and usage numbers for that particular month. So you're going to see ticket volumes, ticket types, those types of things. But then we're also going to provide you with a detailed dashboard. And what that allows us to do is really look into each of those buckets. So not just saying that last month you had 50% activation issues. Well, what does that really mean? So out of that 50%, what percentage of those activation issues were that Social Security number that I mentioned? Some of them may be that their activation code had deactivated, right? Those are the things that we're going to be looking at to really create actionable items for your team to internally make change. So those are things that you're going to be receiving on a monthly basis.
Excellent, thank you. We have another question here that does talk about how do you handle adolescent patient enrollments?
Sure. So we are well versed in the proxy process. We know that the proxy process for every organization is challenging on its own. It's by far the most difficult MyChart workflow, internally and externally to your patients. So how we handle that is through that analysis, we're going to make sure that you kind of have some key boxes checked off. Is the process accessible to your patients, right? Is it, and through that, we're also going to gain that knowledge of what your process is. Our team does not grant proxy access per se, but there are ways that we can use your MyChart tools and workflows to help that be a seamless process for your patients. And that's where that patient focused support model comes into play. Again, our team is well versed with this process at multiple organizations. So really understanding those challenges your patient is going to face and making sure that they are getting resolution while they're on the phone with us, or making sure that we can close that loop for them.
Okay, excellent. I also want to go back, if I can here, excuse me, as I kind of flip back here, but I want to bring us back to, oops, I went a little too far, back to this slide, Mandy, because there is a question here about the study that the University of Iowa Healthcare undertook, and it talks about, is the cost model based on a number of calls?
So I believe that this study was based off of a per call. So we would look at the fact that an individual, so each appointment management call, each appointment customer service call would in fact have that $3 range to each one of those for that time and effort consumed to complete those individual tasks, is my understanding from the study. Again, that information is there. It's a great information. So feel free to look and follow up. And there's additional information outside of the benefits to the patient portal approach as well in there.
Okay, great. Ladies and gentlemen, I'll leave it here on this slide. The study that Mandy is referencing, there is the footnote here that you can certainly go out and look for more information. Okay, we've got another question here. So if I'm already using Epic MyChart Patient Portal, would you be able to do just an assessment on our program?
Yes. So again, our experience and knowledge is what's created this suite of services and solutions. By no means is it a one-fit-all, right? Everyone's at a different point in their Epic journey. So if it's something that, you may have a contact center already at your organization that can provide the support, but you really need help in that establishing more of a MyChart program, creating that oversight committee, looking at how to best use your functions and features, retraining your staff, right? So you can pick and choose from this line of services. It all depends on what your organization needs and, as I said, what part in your journey you're at.
Okay, excellent. I've got another question here, actually kind of a two-part question, Mandy, is in your findings, what is the number one reason that a patient is calling for support? And then the follow-up to that is, how does that end up affecting the health system's support resources, or what does that take those resources away from?
Yes, so by numbers, of course, the number one thing we see is a password reset, number one thing. So how does that affect your resources? Well, depending on your support model, if you are currently, like I said, if you have a contact center built into your organization, right, they may be fielding other patient-facing questions. So it just affects their workload that way. But what we typically see is that, you know, these calls are being routed to your Epic analyst as a support model. And so it really hinders what they can focus on, what they're working on, right? They're no longer working on true, you know, workflow issues internally, or working on an optimization work list that needs to be done, or rolling out those new functions and features. It truly takes away from that work effort. We see possibly anywhere from 30 to 40% of an analyst's role can be used in that capacity when they're having to support MyChart and patient portal calls. Not to mention, a lot of times the support is not real time. So they're reaching a voicemail or sending an email, and they're not having that quick turnaround time. And as we talked about, when patients don't receive that, a lot of times they'll quit using the function or feature altogether. So that's usually the impact that we see.
Great, thank you so much. Ladies and gentlemen, if you have any other questions, please feel free to submit it using the Q&A panel. I don't see anything else coming in at the moment, Mandy. So ladies and gentlemen, I want to thank you for your time. We know it is very valuable. We appreciate you spending it today with us to learn more about supporting your patients through an effective support model. And we hope that you learned a little bit more about how our EHR services team might be able to work with you on that support model as well. So with that, ladies and gentlemen, that ends today's presentation, and I thank you.